health conscious is your responsibility.
Know your status. Go to any hospital. Tell them you want to check your blood sugar because early diagnosis is key to the management of diabetes.
Stay informed with every vital information that can enhance your well-being by listening to Health Break every Tuesday at 11 a.m. on your #1 family radio station, Inspiration 105.9 FM.
It's time for Health Break. My name is Ima Dem.
Join Ima Dem in a 30-minute health talk with medical doctors and personnel who have answers and solutions to the myriad of health issues bugging our lives. Health Break with Ima Dem every Tuesday at 11 a.m. Health Break, keeping you informed to help you stay healthy.
A very warm welcome to Health Break this Tuesday morning. My name is Ima Dem. On the other side, I have Dr. Aniefiok Jumbo, the President, Association of Resident Doctors, University of UUTH Teaching Hospital, UUTH, live in our studio.
Thank you very much, Ima.
Okay, so straight to the point. Obviously, when people get to hear President, Association of Resident Doctors, UUTH, they can, to an extent, think about what we are talking about. That's what is on the front burner. The planned strike by resident doctors, and we know just days away before we get to hear what the decision is. So we look at what's happening. The resident doctors had on July 30, 2022 issued a 2-week ultimatum to the federal government to implement agreements with the association. So we are back to this table, having unmet demands. And so we look at some of the requests, which I'll just highlight, and then you get to touch more about that. Federal government to expedite action on payment of the newly reviewed residency training fund, the issues around the training fund, and then we also have the immediate implementation of a new hazard allowance and arrears as contained in the circular from the National Salaries, Incomes and Wages Commission. We also have the situation around brain drain. We're seeing a number of doctors leave Nigeria to other countries to practice. And so we see the statistics showing the doctor to patients ratio 1 to 600, and we are getting to see it widening. 1 to about 5,000 patients.
5,000.
That is scary. So these are the issues the resident doctors are bringing to the fore and saying we have unmet demand still. Please, can you talk about some of this again, particularly starting from the residency training fund, what that is all about and why we are still going back and forth?
Okay. The Medical Residency Training Fund is a fund made available by the federal government and also state government training resident doctors in order to mitigate the hardship incurred in the process of training. The process of training is encumbered by the monies you would need to pay, both locally and internationally, even with foreign currencies in some of the exams where you need to be certified fit to train as a resident doctor in the process of becoming a specialist and later on appointed a consultant by a facility. So that is the Medical Residency Training Fund.
Okay, so there was a review to the residency training fund, and that is what the doctors are asking, that the government should expedite action on the payment of this one. How long is being owed?
It's not only the reviewed amount.
Okay.
The duty to allowance was reviewed for all federal workers, and which would also impact on the medical residency training fund. More so, our members are being owed even the 2020 medical residency training fund. Not all were paid. 2021, we still have some members being owed. Then also the 2022 is yet to be paid. Now, this medical residency training fund is supposed to be paid in the first quarter of every year before the examinations, before the update courses, before the series of training in the year, just so that the resident doctors don't use their salaries as they've been doing to pay for these trainings. Because the
funds are not coming.
The funds are not coming. And we've waited till this time and nothing is being achieved so far.
Staying on the residency training fund, there was an issue that cropped up 1 year ago, 12 months back, where the Minister for Labour and then, and Productivity, Dr. Chris Ngige, is a medical doctor, amazingly, talked about the residency training fund and the issues around it. He said the federal government wrongly paid 588, that's the figure he quoted, 588 doctors medical residency training fund. And he had asked that university teaching hospitals should rectify that, sending the records and asking that the numbers of persons or doctors that were paid wrongly, there should be a refund. What is that? Where are we at this point, 12 months after? Because now you're going back to talk about this. Has that been sorted?
Well, to the best of my knowledge, that has not been sorted. We've pushed the ball back to them, that the employer should know their employees. And if that is not the case, then they have themselves to either be blamed or something needs to be done about that, not pushing the buck back to the resident doctors. So if some people were wrongly accredited or maybe wrongly paid, then the employer should identify those that were wrongly paid, recoup the monies, and pay those that should be rightfully paid.
Let's even look at the hazard allowance, because that's also part of what the resident doctors are talking about. The association is saying there's still issues with that in terms of the agreement that was met. How much is the hazard allowance at this point? Is it something you want to mention? I don't know, but then we know that's also a problem, and that is what you're also fighting for,
yes,
with the arrears as well.
Yes. The hazard allowance is laughable, and it's I would say derogatory. The hazard allowance is 5,000 naira per month.
We're still not like it has been increased, because I can remember doing a program and talking about this. That was the same amount that was mentioned. So as we speak now, it is still 5,000 naira.
It is still 5,000 naira. Even after the series of 2-month strike in August and September and the whole back and forth, we had an agreement in December, precisely to the 22nd of December last year. And even after that agreement was reached, up till now, there has been a snail speed in the implementation of the hazard allowance, and it has still remained 5,000 naira. The reason why it is still 5,000 naira is not known to us. And you would go to them and they will tell you, oh, it's at the Ministry of Finance, or it's at the National Incomes and Wages.
Okay, so when you
Secular needs to be taken down here. Like, I don't know why. Okay,
so when you say implementation of the new hazard allowance, what is that exactly? So what is a new hazard allowance?
It ranges from about 22,000 naira. Some will get 30,000, some 35, and some 40,000.
So you're trying to move from 5,000 naira?
At least move from 5,000.
Which is what
naira.
the doctors get?
Yes. But we at the NMA and the Nigerian Association of Resident Doctors have proposed the percentage of basic salary template to be used for the hazard allowance, but the federal government chose to pay a flat rate of specific amount. Then after much back and forth, we agreed to their proposed plan. Now that we've agreed a long time ago, since December last year, they are yet to even carry out what they said they would pay.
Okay, I'm speaking with Dr. Aniefiok Jumbo. He's the president, Association of Resident Doctors at the UUTH here in Akwa Ibom. And so you can be part of the program. We are talking about the planned strike by resident doctors. They're threatening that they would decide to go on strike. So they've given government an ultimatum, and just as you count down to the weekend, they would also meet on Saturday. There's a net meeting coming up.
Yes, in
where you can now decide what to do next.
Yes.
Okay, you can be part of the program. The numbers to call in with 0818-222-9105, 0818-222-9105, 0905-995-1059, and also the WhatsApp number to send your messages to this morning, 0906-030-8705, to be part of the program. We're talking about the doctor's plight. We're talking about doctors' welfare. We're talking about Nigeria's healthcare system, the focus on doctors' welfare, and we're seeing how much the doctors are complaining, particularly when it comes to welfare, when it comes to the work situation, and how some of the agreement that they had entered into with the federal government, we are coming back to see that a number of those agreements have not been met. Demands unmet, and the doctors are saying another strike is looming. And you can imagine, going to the hospitals and not having the doctors on ground to attend to us. We've seen this strike happen before. We do not look forward to having that happen again. And it's very disturbing that we have to keep talking about this, going back and forth on these issues. I'll come back to you, Doctor, particularly to talk about the residency training fund. And most times when people hear resident doctors, what comes to mind, the problem is from the center. But then I realized that a part of the blame or some issues or some of the demands, you're expecting the state government to respond to them.
Yes. Like you find out that the state government sends some of their doctors to the teaching hospital so that they could be trained as specialists in order to increase the number of specialist doctors in the state. So these residents, these state doctors are also entitled to the medical residency training fund. And this residency training fund is yet to be domesticated in Akwa Ibom State, just like it is done in Delta State, it is done in Benue State, it is done in Lagos State, it is done in Nasarawa State, just to mention but a few. Akwa Ibom State is yet to domesticate the medical residency training fund. So meaning that the doctors sent for training across Nigeria as resident doctors don't benefit from this fund. It means that they use their salaries, their paltry salaries, to take care of this training. They would use that same salaries to pay for accommodation where they are, and also buy their training materials, and also pay for the updates, courses, and exam fees. And one thing I want people to also know, that being licensed to practice as a medical doctor, there are courses that you must partake in or take yearly, number of courses you must take yearly for you to be granted license to practice in the next year. So these cost money. So if every doctor in Nigeria undergoes those training, even the medical officers, there are trainings that they must partake in to have what we call the CMEs. They pay from their pockets to get
so why is it
training.
taking Akwa Ibom, a long time to actually domesticate? Even some other states, even neighboring states, have actually domesticated this fund. What is the problem with Akwa Ibom?
Well, I think maybe the government will need to respond.
What are the feelers you're getting, in this regard? Because I'm sure you've also reached out to the government or tried to push for the domestication to happen.
Yes. When we did this, I forwarded the circular to the Commissioner for Health, and the Commissioner for Health has been interfacing with some of the state doctors, and hopefully the government will come to their aid and domesticate this medical residency training fund so that Akwa Ibom state resident doctors would benefit from that fund also.
Okay. We also look at another issue now, the arrears, salary arrears that you're also pushing for. 23 months, right?
Yes.
That's a long time. So how,
It's a long time.
I get to think, how are the doctors surviving?
I think the public should rise and also fight for the medical doctors. It is appalling that a medical doctor will be owed salaries. Now, you look at it, it's annoying when you hear that a doctor is not being paid, even if it is 1 month's salary. And you say these are emergency care workers or these are critical care workers and all of that. They should be treated like that. Okay, look at the doctor, Dr. Stella Dedavo, that died in the course of preventing Ebola from ravaging Nigeria. Her hazard allowance was 5,000 naira. And up to date, even the federal government has not immortalized the lady when there was COVID in Nigeria. See the way the doctors were mobilized to curb the spread of the COVID-19 pandemic, even in this state. The response was
on
huge.
record that we lost a number of doctors.
Yes.
And even Lassa fever, I also hear doctors are losing their lives as well.
They die without insurance. They die and their family members suffer. They bear the brunt after training a doctor. Some not just Lassa or Ebola and the rest. Some with hepatitis and the likes. So these are job hazards. And the hazard allowance is still 5,000 naira, and the work conditions are not optimal. So these are things that are annoying, and to add insult to injury, you are now owing that doctor salaries, and up to 22 or 23 months, now it's 24 months. That's like 2 years salaries. 2 years salaries. Then you see people travel abroad to go see Nigerian doctors abroad, and receive treatment there and fly down. Can everybody fly out of Nigeria to go get treatment?
That's a very big question, because I just imagine that, the doctors decide to go on strike again. We've seen that happen, and it lasted for quite a long time. And then what we saw was people going to the hospitals to seek treatment. Like you said, not everybody can fly out. Not everybody can do the private hospitals.
Yes.
We still have people that get to use the UUTH, for instance,
yes,
and other public institutions. Hello, good morning. Hello, good morning. Seems like we have a caller. Okay, keep your calls coming through. 0905 995 1059. The numbers to call in with to be part of this conversation as we talk about the Nigeria healthcare system and focus on doctors' welfare, the issues on the table as we speak. I think some of the issues that we had, the doctors, frown out the last time and decide to go on strike, a number of them have not been resolved. And so we see another strike looming. So we talk about all this, and then we look at the issue around brain drain.
Yes.
You just mentioned doctors going out of the country to continue practicing because of some of these issues that we've raised. I think I have a caller on this line. Hello, good morning.
Hello, good morning.
Good morning to you. Welcome to the program. What's your name and where are you calling from?
My name is John.
All right, John.
Calling from Ikoraba. Good morning, doctor.
Good morning.
When we continue to hear issues like this, look at doctors, look at lecturers. Do we have people who are right-thinking individuals in government? President, governor, senators. Look at doctors, 5,000 naira as an allowance, and then 24 months owing a doctor. Whether they are surviving anyhow. In fact, sometimes I think that if not for changing bad leaders in governance, this country, I don't know where we would have put these present leaders. There would have been no election if there is strike. So please, whatever the governors need to do, like domiciling the training fund in Akwa Ibom State, what is holding them? Do we have value for life? When people go to the hospital, do we want those doctors to attend to them and attend to them wholeheartedly? Please, whoever needs to attend to their plight or whatever should do it very quickly. Because when I hear things like this, it breaks my heart. I'm telling you, the whole discussion, I'm not very comfortable.
All right, thank you so much for calling. Keep your calls coming through. 0818-222-9105, 0905-995-1059. What do you think the way forward is? What are the solutions we can actually embrace? This is not palatable. We get to hear this happen over and over. Yet again, we are so worried about the reality or the fact that the doctors might decide to go on strike. And then what even bugs me the most is you enter talks with the government, you sit on the same table, an agreement, is reached, and then we have to wait for another time or another moment where the same parties or the same party that the government has, interfaced with coming out to say what's happening. Nobody is saying anything. So why does it seem like someone goes to sleep after some of those agreements have been made? That's
the issue that we face. And you find out that this is not the first time we've been given we've given ultimatum. We met in Nasarawa for a meeting and gave the government 2 weeks, and the 2 weeks elapsed without response.
Okay, we have a caller.
Hello.
Good morning to you. Welcome to the program.
Hello. Good morning.
We can hear you loud and clear. Go ahead.
Yeah, my name is Richard Inyan, calling from Ibeshikpo. I sympathize with the doctors a lot. But I want to suggest that the only solution to this matter is to remove Ngige as the Minister of Labour. I'm surprised that Ngige is a medical doctor. That is why sometimes I used to doubt his certificate. Because if he's so sympathetic and was trained as a doctor, in fact, he's not an ideal doctor. How can you allow doctors to be old? She has that allowance. You agreed since last year that you were going to increase the hazard allowance, and you are now still leaving these people to suffer like this. So my solution, you were asking for a solution. Let Ngige go. If Ngige does not go, no will.
Okay.
Tell me the truth.
Thank you so much for calling on the program. You were talking about agreements being reached and then the ultimatum given to government over time.
And we also met again in Ilorin, in Kwara State, for another meeting. We reviewed the progress made, and we also decided to give the government another 2 weeks to implement these things. And the 2 weeks will elapse today, and nothing
concrete has come out from.
Nothing concrete has come out from it. And that's why we are having another meeting in Jos. And the federal government should know that these meetings that we owed cost money, and the lives of citizens are being risked, considering the security of the nation today. Getting all NEC members across the country to travel down for meetings and all of that. We spend money, we risk our lives on the road and even by air and all that, just so that an agreement that was duly signed, that was duly reached, and all parties embraced each other and went back home was thrown, would I say, to the dustbin of history, or perhaps
not giving priority.
Not giving priority. So these are the issues. The issues are now becoming perennial, and it's exasperating.
Okay, so I'll still go back to what is also very, very disturbing. The way doctors are moving out of Nigeria in droves.
Yes.
That is also what the association is fighting for.
Yeah.
The exodus of doctors. So we see this happen, and we can't help but just get to think about what doctors are going through, and that's very easy for them to just take that decision to move away. Good morning to you.
Good morning.
Thank you so much for joining us. What's your name?
Yeah, my name is John. I'm calling from Oyo.
Please go ahead.
Please, I want to ask the guest in the house. I'm told that their answer allowance is 5,000, which is nothing to write home about. Consider the risks they are putting their lives online for a patient or for somebody to survive. I want to find out whether this fight that they are fighting as doctors for the answer allowance cutting across all fields of medical officers, for instance, that is including nurses, or nurses have to come and fight, because I'm hearing the doctor talking, but I'm not hearing mentioning nurses. Are they cutting across? Are they touching them, or is it only for them? Then the other cause that they have not domesticated the fund for training of doctors. If other states are doing that, I think they should look inward. They should look inward. Why should the UUTH in Medical and other states implement it? Then the one of you is a problem.
Okay.
Assuming that we don't have people that can fight for them in-house. Then number two, the other corner condemn ask me to go. My dear, this Ndike is a obedient servant. Somebody sending, he didn't have all his power. If he has all his power, he will do that. Things. His obedience is just there like a figurehead.
Okay, thank you so much for calling. Thank you so much. Noted. Then you respond. You just wrap up to respond to that. But then let me reiterate some of the things we've talked about with the comment that was made by the president of the National Association of Resident Doctors. I'm talking about Dr. Ishaya, Dr. Dare Ishaya, and he was talking about the factors, the reasons doctors are leaving Nigeria. Let's take a listen.
Most of the factors we have always been advocating are some of these things that bordered about engagement of doctors who work and will not receive their salaries. Also, we noted that that is actually the reason why we said that there may be need to increase budgetary provision. Lack of funding for research, for instance. Almost year in, year out, the budgetary allocation does not provide enough funding for research. And as such, almost every professional want to progress in his career. So because of that, that in funding for research, those who want to advance go to places that they feel they can have the funding for them to progress. Then there are other factors. For instance, security of life is very, very important at workplace. Most of our colleagues are being kidnapped on daily basis or assaulted. So those without being given the necessary protection, those are things that some of our colleagues do consider, coupled with unemployment and other factors that push them. They go to where they feel they can get a better standard of living and also education for themselves and also their families.
He said very key things, and that still buttresses what we are facing. He's talked about, non-payment of doctors, owing doctors, and a very critical aspect, research. He talked about research as well. A lot of doctors will want to go where they can actually get their research funded, because that is a very critical part of growth for doctors. Talk about that and then just answer the caller's concerns.
Okay, the future of medicine is in research. And doing one thing over the years without finding new ways of doing those things would make that practice obsolete. So globally, research is the way forward, and Nigerian doctors are also participating in researches. And there are some diseases that are peculiar to this environment, and which only researchers from Nigeria can go into and understand, and they see these cases regularly. So these researches are being funded personally from that same salaries that we are being paid like others. There should be a research fund for doctors and also all researchers. Like the last caller asked, the hazard allowance is not just for doctors alone, it's for all health workers.
Okay.
So it's not just for doctors alone, but the doctors take the lead.
So still talking about, this research matter. So Dare Ishaya has also advocated increase in budgetary allocation for health.
Yes.
So we can actually look the way of research for growth. Possibly if doctors can stay back to do their research, they won't have to leave.
Yes.
En masse.
Yes, they won't have to leave en masse. And that way will put Nigeria in the global map of researchers. So I think research is the way forward, and that's the way to go.
Okay, at this point we don't have time anymore, but what's your concluding thoughts as it becomes extremely sad, and realistically speaking, that strike could happen if the meeting comes up on Saturday?
The strike could happen. The NEC members will decide whether to go on strike or not. But also I would want to say that to curb the brain drain also, I think we need to also go back to some practices that we've been doing, especially funding medical students in Akwa Ibom State. Over the years, medical students in Akwa Ibom State have been paid the medical students grant in the dispensation of His Excellency Obong Victor Aftar. He paid 50,000 naira to medical students yearly, and when His Excellency Governor Akpabio came, he paid 200,000 naira to medical students yearly to help the training, and we are yet to get the governor, Mr. Odom Emmanuel, to do same to medical students. These are things that will curb brain drain. These are things that would increase the number of students going for medicine and also staying back in the country to practice. So I think the practice of paying the medical students grant should be resumed, should commence again. Okay. So thank you very much.
Thank you so much, Dr. Aniefiok Jumbo.
Yes.
For coming on the program. President, Association of Resident Doctors, UUTH, that's the University of Uyo Teaching Hospital. It was a pleasure having you on the program.
Thank you, it's my
pleasure. And we all
also
pray. We keep praying, but then we need to do the needful as well. We all pray that we don't have to go on a strike. I say we, because even the masses will be affected.
We also don't want to go on strike.
All right then. Thank you so much for being a part of Health Break. Next week, same time, the program returns on Inspiration FM. My name is Ima Dem.
Inspiration FM.